But at that early stage, it was hard to work out what questions to ask because we were still in no man's land, not really understanding what the impact was going to be. It's like, this is going to happen, but we can't really tell you how it's going to affect you, and you can't really ask us questions because we can't answer them because everybody's individual.
Diagnosis is a very difficult time. It's a time where suddenly you're given information that you've not had before. You're asked to digest a lot of strange words. The doctors use big terms. They ask you to make medical decisions really quickly. You don't even understand what half of the language is about. So it's really normal to feel confused and alone at that time, you know, and it's the beginning of a grief process because no matter what happens from this point, you've been told you have cancer and so your life has changed. You know, so trying to come to terms with that is a huge thing. So it's very, very normal for people to struggle with that and to feel very isolated and alone. It's good to take someone with you to the appointments if you can. If you haven't got someone you can take, you can sometimes ask the nurse to sit in with you. Try and take notes. We give you a lot of information and most people are so stressed they take it home and don't look at it. The Cancer Council particularly have information books. They have question prompt lists in the back of them, which are really good to look at and take to your next appointment with your doctor. They help guide you to know what questions to ask.
Having family members with you when you're listening to that sort of information is vital because you don't really hear a lot of it. Rani was the one who said, "No, Mum, this is what they said and this is how it was going to be done." And you're there taking the information that's relevant to what's going to happen to you, but other family members are also listening a lot more closely, probably. I was a little bit numb about it still.
The most important thing is, I think, have the ability to ask the doctors questions, be whatever they are, and there's no such thing as a silly question if you don't know the answer.
It's important to ask questions. If you don't understand what's being said by the doctor, even if you don't stop the doctor and ask them, ask one of the nurses or the care coordinators. Often one of the jobs we do as psychologists is to see people to work through some of those issues and work out what they want to do. You know, it's a big question and often it's a question you have to decide on quickly. What am I going to do? When am I going to have my surgery? What do I have to do? So try and reduce that confusion. Ask questions. People are more than happy to answer your questions and there's no stupid questions.